Welcome to your medical unit huddle for June 21st through the 28th. I'm Ricky, your nurse manager. It's been a little while and I'm back. I have quite a few things to cover. One is the employee voice survey. You guys took that several weeks ago. Thank you for taking that. This go round was in regards to trust. Overall, we had a pretty good rating, so thank you guys for that. We got to keep that momentum. The only little area that we had that we scored a little bit low was whether or not decisions are made at the best levels. And if you really want to get some bang for your buck, I highly encourage you to join our unit-based council. We did have that this past week and we had a pretty good turnout, so I was pretty happy with that. But don't forget that that option is there. Even if you're like, I don't want to commit to be a member and show up every month, if you have any ideas, you can always go to that meeting. I'm always there too to help remove barriers if you have ideas and you feel like you're just not getting anywhere. But otherwise, you have a great team on there too that can help. So let's get right to it. You also started self-scheduling through Kronos. That seems to have been a huge hit. So thank you guys for cooperating with that and letting that go smoothly. Just also remember that the schedule, I did have to block that when you're doing your time off requests. There was quite a few that I was going through that people had requests from nearly a year ago and then you forget why you requested. So unfortunately I did have to put a lock on that so we're not getting ahead of ourselves. Have any questions? Just ask me. Okay, so for quality, turn teams, please make sure if you are on a turn team that someone is documenting that turn, or if you are moving a patient in any way, please make sure that you guys are documenting turns or walks or whatever. We are doing audits on that and we kind of stink on documenting that, and we want to make sure our patients are getting credit, right? A lot of times the physician or case managers are looking to see how patients are moving so they can get the heck out of here. Also, our goal for 2019-2020 is happy. We did have our happy fair this spring. Pretty much everybody went to that, but a big push or help with the happy reduction is the turn team. So that's super important, guys. All right, for patient experience, also with the happy, you guys did your niche modules, so thank you for doing that. I am meeting next week with Liz, our coordinator for niche, to see what is our next step with that. And then again with patient experience, I did send out the NRC for this week, and one area that we are taking a dive is with communication with our patients. In particular, are we taking the time to listen to our patients? I know it's super busy, but please, when you go into a patient room, make sure that you're taking the time to make eye contact with your patient, that you're taking the time to listen, whether it's repeating what they say or, you know, nodding your head or just make sure that you guys are slowing down. That also helps with reducing burnout. If we're just gonna go, we're checking the boxes, going into rooms, doing our thing and leaving, we kind of forget why we're doing what we do in the first place. And that is to have that connection with our patients and give them the best experience when they're not feeling well, and you know, it fills our cup and it gives them, again, that good experience. So for recognition, we have a couple newbies with us. Well, it has been a couple weeks, but Kirsten is a full-time nurse, as well as Shelly. So if you see them, welcome them. And then we also have Chris and Nick, who are PRN day shift PCTs, and then Jenna, who is a PRN nurse. So if you see those folks, tell them hello. And then just a couple reminders. If you have pumps, the Alaris pumps in the rooms, and you're not using them, don't wait till the patient is discharged to actually take them out of the room to get them cleaned. We're seeing kind of a backup in getting pumps available or the channels available to patients who actually need them because they're just tied up in a room for no reason. If we're not using it, get it out and so they can, biomed can get those turned over and cleaned. And then you'll also notice your charge nurses now have a red phone that they're carrying. That is a telephone, like a telephone, telephone. I just realized that was funny. But Telly will call them if batteries are dead, if there's you know, any type of emergency that they would need to go and see the patient. A lot of times, and they understand that the nurses and PCTs are pretty busy, so they will be calling that phone to get more of an immediate response. So have some grace with your charge nurse, because now they're carrying 2 phones and a pager. Also, last thing, reminder that your self-appraisals are due on the 28th, so please make sure that you have your self-appraisals done. That also includes if you were assigned appraisals, peer appraisals, please make sure that you guys are getting those done as well, so we can get cracking on those, okay? All right, well, that's all I have. I am going to turn it over to your charge nurse for any current quality patient safety concerns. And as always, I encourage you to subscribe to our MCR Medical Unit YouTube channel. And you guys have a great shift.